Okay guys, this is my first attempt to try to record some video that explains some of the handouts that we're going to use for work conditioning, work hardening. So this is the first of those, and what this is basically is a summary of Rule 20, the Section 34, which is the rules that govern the administration of workers' compensation programs in West Virginia. So depending upon what state you're in, they may actually be a little different, but these guidelines themselves were used as a basis for the guidelines that were established by the American Physical Therapy Association. So if you're working in West Virginia, these guidelines will work. If you're working somewhere other than West Virginia, then they're going to be guidelines that are kind of pretty similar to this, maybe not exactly the same, but pretty similar. So when we look at functional capacity evaluations, what we're doing is looking at a test. So FCEs are a test that is designed to be able to quantify, right? Quantify. So what a person can or can't do. And the key issue here is essential. There's lots of things that people need to be able to do at work, but when we look at functional capacity evaluations, we need to determine what's essential in their ability to be able to do their job in a way that is safe and productive. So this is a series of tests that look at what somebody can do, not necessarily what they are able or willing to do at a particular time. And these tests are done principally by PTs and OTs. Sometimes there are other professionals that do these tests. There are exercise physiologists, athletic trainers. Paula, for example, does these tests, and physical therapy assistants are used to some degree in the collection of data. So as a physical therapist assistant, you cannot evaluate, but you can examine. So you can collect the information. And in our practice, what we do is that Paula and I do these tests together. So she does the majority of the data collection, i.e. work, and we do a collaborative report and analyze the data together. So that's really an overview of what's being done. And what we're going to do is we're going to look at what they can or can't do physically and functionally. Are they able to go back to the job that they did before? What is their physical demand strength rating? And we'll talk about that in more detail as we go along. And what their material and non-material handling abilities are. And basically, material handling is lifting, pushing, pulling. Non-material handling is everything else. Sit, stand, walk, bend, feel, crouch, and this is defined in more detail later on. But material handling, if you think material handling, it's material, it's moving stuff, picking up, pushing, pulling. This is non-material handling, it's not picking up, pulling things. So these are the things that we look at, these 4 items here, and this is important, and you need to know that anytime you see a list of 4 things, then there's a good chance it's going to turn up on a 4-point multiple choice question somewhere. Now, there are all kinds of functional capacity evaluation. This is a really big basket term that incorporates a lot of different things. And these can be done, these assessments or tests can be done pre-employment, post-employment, for lots of different reasons. But we're typically here looking at situations that involve an individual that has been hurt at work and is off work or is looking to go back to work. And there are 2 kinds of assessments that are done or defined in West Virginia. There's a level 1 and a level 2 assessment.